I am Community Chloe. Welcome to Her Story RVA. It's a virtual women's empowerment series curated by us, Black Women in Mind. This episode is sponsored by Urban Baby Beginnings. This evening, we will be discussing the importance of understanding your rights in maternal care, the importance of culturally competent care, recognizing and addressing implicit bias in healthcare, and so much more. Tonight, we're joined with the founder and executive director of Urban Baby Beginnings, Stephanie Spencer. How you doing?
Hi, Clovey. It's good to see you again.
And good to see you. And we also have a special guest joining us tonight, Dr. West, who will be that important. She's going to lead the conversation. Dr. West is a board certified pediatrician and newborn care expert. Come on in, Dr. West.
Hello, it's a pleasure to be here.
Well, thank you all for being here tonight. I want to start off giving the floor to you, Dr. West, to introduce yourself and discuss RVA Baby and its mission in more detail. We need it.
Okay. RVA Baby really is a patient and family centered approach to perinatal care. A lot of times we either focus on mom or we focus on dad or we focus on the baby. And my mission really is to focus on the family. And in doing that, helping families navigate that postpartum journey from 0 all the way up to 3 months in my in-house practice. And then they can continue in my direct primary care practice after that. But my passion is to make sure that families have the coaching that they need. A lot of times they know what the resources are, but they don't have access to them 24/7. And I make myself available to those moms and dads pretty much round the clock, and no question is off limits, so that they always feel supported and lifted up during their postpartum journey.
Dr. West, this is so important, and thank you so much for being here this evening. Now, Stephanie, understanding your rights in maternal care is always a top priority. Can you discuss the fundamental rights mothers have during pregnancy, childbirth, and postpartum care?
Yeah, absolutely. And it's funny that this came up because there's been a lot of work surrounding trying to help families understand really what their rights are in childbirth. It is important to recognize, and also postpartum and recovery and things like that. But it's also important to recognize that I'm not necessarily elevating state law. I'm just talking about general concepts about care today. And so what we tell moms is that they have the right to health care and they have the right to pick and choose the providers that they feel are most important in their care and the delivery of care. They have the right to have support, whether that be from a birth companion or a doula or another professional, and that they have the right to choose the friends and families and support team that are present during their pregnancy, birth, and postpartum care period. Um, Women have the right to access independent advocacy, perinatal advocates to address their concerns, and they have the right to change their care provider if necessary. So they can choose that care provider, they can change that care provider, and they have the right to determine their birth setting at any point in time. So whether that be at one hospital or another or at home, they have they have those choices. They have the right to ensure that their care acknowledges and affirms their strengths. So really thinking about it from the perspective of like Dr. West mentioned, uplifting families and really acknowledging their strengths is really important. And women have the right to receive care that acknowledges that. They also have the right to incorporate their traditions, their faith, and cultural practices in their birthing experiences, and also that they have the right to receive care that's free of discrimination and racism and violence, obstetric violence. A couple of other things are that they have the right to access remedies if they are if they are mistreated or neglected or discriminated in any way or violated any way. And they also have the right to make medical decisions for their baby. We have the right as women to receive uninterrupted time with the baby and also to have healthcare providers that listen to them. And I would say of what is most important is that women have the right to ensure that their humanity is recognized and acknowledged, and to be treated with dignity and respect at all times, and that they are able to make decisions. They have the right to make decisions that are informed. So, making informed decisions, being able to nourish their babies and have those choices supported is a right that all women have. And that being able to provide informed consent or refusal to procedures or processes that people have identified and elevated are their right as well. I would also say that during like childbirth and things like that, women have the right to have individualized care plans related to their pain and their labor pain relief. We also have the right to individualized postpartum care. So there are all types of care that people can receive, and that they have the right to receive mental health, whether it be holistic care or care in general that includes screenings, treatments, and referrals. And again, at the end, they have the right to receive support in accessing these care and services that are extremely important, and to ensure that others are included in that care, such as partners, husbands, or otherwise.
Well, Stephanie, thank you so much for explaining to us and how you need to be assertive about this. This is all news to me because I thought if you have chosen your healthcare provider, that's it. You're all in while you're in the midst of your pregnancy. So thank you so much for stressing that. Now, Dr. West, I see you shaking your head when we're talking about being assertive when it comes to your rights. But then we're going to go into why is culturally competent care important?
From the 50,000-foot view all the way down, a lot of these issues are problems with our healthcare infrastructure. It's very corporatized. There's a lot of check boxes that needs to happen. And so marginalized and people of color suffer more from that. But in general, all of maternal health is affected by a really dysfunctional healthcare system, right? So we can talk about the rights that a mom has, but when she's on that nursing floor, on that mother infant unit with nurses who aren't hearing that, there's a challenge for advocating and saying, hey, I don't want vitamin K, or I don't want eye ointment, or I don't want this, or I don't want you to wake me up every 2 hours for the first 24 hours of my baby's life to feed them, because that's not physiologically normal for a baby. A lot of those things are really hard to push back on. And so, my mission really would be to look at how we provide healthcare to parents and being more informed about care. In those settings where moms are receiving care. Because even if they say, this is what I want, this is what I'm entitled to, then the next step is, okay, I need to talk to the patient advocate for this hospital so they can help me get what I want for my baby. And that's unnecessary trauma, right? That's unnecessary stuff that you have to deal with, unnecessary psychological noise that you have to deal with in that postpartum window. And so my push really is, it's great to have a doula and a birth plan, but really getting our healthcare system on board with offering more family friendly childbirth versus, what we call baby friendly, or checking the boxes, or we're worried about our liability, whatever the case might be. Focusing more on what's natural and normal for moms, which is why I'm a huge proponent of birthing center and home birth, because those environments tend to be very natural, very, comforting and warm and welcoming. And they give the family a chance to really decide how they want to bring their baby earthside.
Wow. I like that earth side. I really do. And Dr. West, and of course, Stephanie, thank you so much for this wealth of information to know that we did have rights in that perspective. I mean, they woke me up every 2 hours. I was like, oh my God, I just had a baby. And again, this is very important information. Now, Stephanie, what are some strategies UBB implement to recognize and address implicit bias in healthcare?
I think from the very beginning, Dr. West, number one, Dr. West hit on something really important, is that you get into these systems that already have ingrained practices, and those protocols that they have change the type of care that people would normally receive otherwise. And so, what we really try to do is to surround the mom with information, because I do truly believe that until we can change the systems of care that people are in, that the best way that we can arm people is to ensure that they have information, that they understand what normal may look like and the variations of all of that. And we are working with them to help them to formulate questions, to formulate plans that ensure that when they enter into a hospital or a clinic or otherwise, that they can speak for themselves in terms of what they wish to have and the care that they wish to receive. With that being said, that does look like having an advocate, whether that be an advocate who is a doula or a lactation professional or a nurse like me or any of my team members, really sitting down with that individual, assessing what their needs are, what their desires are, and their beliefs are, and values are in this experience. And then from there, asserting a plan to make sure that that's what's happening as they move forward. And I would say that as we look at the hub and the care that people receive, that it is very holistic in nature, because it doesn't look at just one point in time. What it says is that you as a person, as you're coming to me, how you're presenting to me and your family, I want to understand what all of that looks like. So when you come into my hub and my safe space of care, we can really have good conversation about where you want to go. And though it may not look linear at that point in time, the end goal is the same, to make sure that the family is well supported and that we have the best level of outcome, and that affects future generations. And so we really do think about care and the delivery of care from a community-based model. And what that means that every person in community has responsibility for each other, and our health and our well-being is a responsibility of all of us. And so when we're partnering people with others, such as doulas or advocates or others, we just have that approach because that's how raising children has always been. You know, it has not been this singular approach as a mom where I'm by myself. It's always been that other women, other people are in that experience, or all walking that journey together. So that's what it looks like here.
Thank you, Stephanie. And this is going to be a two-part question for you, Dr. West. Let's start here. As a doctor in the industry, what strategies do you suggest for mothers to navigate situations where biases may be impacting their care? And then give us some tips on how we can best communicate with our doctors and nurses.
If we start with the obstetrician or the midwife from the beginning and let them, and being very forthcoming about what you want, that's the first step. It's hard for moms, especially our younger moms, to do that because they feel a little intimidated because there's this doctor here. You know, you see the nurse for 20 minutes and you see the doctor for 2 minutes, and you don't really get a chance to talk about what you need. But most of those practices do have case managers or patient advocates or someone that you can go to say, hey, this is what I really want, and I want to be able to communicate this with my physician. So knowing that outside of that exam room and that nurse and that physician, there are other folks in that group, whatever that group is, that can give you an ear and help you implement your birth care plan. Again, I sort of go back to, you're in a system that is very structured to check boxes for third-party payment and for safety and all of that good stuff. But a lot of times it's just a matter of figuring out who to tell, and then help. And then from there, continuing to present that message through every visit that you have, all the way through until you give birth and deliver your baby.
Okay, so we start the communication at the beginning.
Mm-hmm.
But if we're in the middle, we should be able, if something doesn't feel right, something hurts, we need to communicate it, right?
And there's no shame in breaking up with your doctor. So it's just like, you know what? This is not where I need to be. I need to be someplace else. And it's almost like you're breaking up with a hairdresser. People think of it as like, you know, is that personal? It's not. Let them go. Move on to something else and find what works for you.
That is so good, Dr. West. Thank you so much for this wealth of information, so needed. Now, Stephanie, UBB is always providing resources, support, connections for mothers, and of course, doing Her Story RVA. Why should a mother utilize maternal hubs for support? And Just how valuable are they?
Oh my goodness. So, I mean, I've worked with thousands of women over the years. You know, these hubs have been standing for 30 years. This is our 30th year. And the hubs were built by the mothers in community who had not necessarily received the support and services that they needed at the time that they were pregnant. And so we gave them a space to be able to come forth and to build this system. And together we've done this alongside of them. And so think about what I had said earlier about motherhood, and it's not meant to be done in this vacuum. And so when you engage in the hub, you engage with other mothers who have gone through these very experiences. And it's important to realize that lived experience is an experience that is extremely important to be able to share, because what it allows for people to do is not only to connect with others and to normalize what's actually happening, it also allows for people to have what I call, you know, the ability to pick the other brains of other folks who have gone through this and to get to the right places. You often see that like on social media where moms will get in the moms groups and all, and they all like band together. The hub is very much like that. But the other part of why the hubs work so well is that we have those connections to trusted providers like Dr. West and others who are doing this work at the ground level. And so when there becomes an area where on the clinical side or on an emotional or physical side, we aren't able to connect well, we don't know what to do, we have professionals that are there that can get folks into those right places. Aside from just making sure that people aren't suffering and alone by themselves, just simply because there's a resource that they cannot connect with or a program that's at capacity and no one has taken the time to give them additional information to make sure the mom and the baby are safe. The last thing is just we just finished an independent study, and I'm sharing it because I think it's really important. And what it was related to the mothers and how they perceive the care that they received from the hub through care coordination and doulas. And these moms came out, and over 96% of the mothers said that their stress and anxiety, their depression, all of those things reduced significantly because of engagement within the hub. And so I'm not telling anybody to say that, this is what they are saying. And so it lets you know that the hub is extremely important. It represents a concept of community-based care, loving on other people and bringing things together. So then that way you're not doing that alone. And that's why that's important. And in terms of connecting to those resources and things like that, I do believe that why the hub is also important is because what we're trying to do is to make sure we're creating a safe haven for the mother, the father, the baby, so that when that baby gets here, and hopefully that baby is here full term, you know, healthy weight, mom is breastfeeding and all the things that she needs. And you can't do that if you don't think about what it looks like earlier on, because you need to be connected early to get those type of experiences in the end. And so that's why engaging with the hub is important. I'm really proud of the moms and what they've accomplished, and to be along this journey alongside of them. And also to remind people that we have 5 maternal hubs now. When we started, I think, I can't remember how many we have, but we have 5 now that are in 3 regions of the state. So there should not be any mom who is in need of care or services in 3 regions of the state that can't reach out to us and get that care, because we don't want them to be alone.
Mm. Stephanie, thank you for that. And how do we overcome some of the barriers when it comes to accessing maternal health resources?
I think from the mom's perspective, well, just overall systemically, I think there has to be a good understanding of what people need, and that we take time to build those systems of care. Because the reality is, if I keep telling you that I have a huge need for lactation support and everything that's being done is around not creating that system so that I can get lactation support, I can't be successful in that. I think overcoming barriers is one about communicating, making sure that advocates are also very aware of what the needs are, but also putting, as families, it's important that you come to the forefront of conversations about you. And so finding spaces where you can share that information so that the tools and resources and things that you need are built and accessible. Last, I would say that sometimes barriers are there because people don't necessarily know the ins and outs of the system, and we don't make it easy. and we don't really get those resources up front. And then the resources that people sometimes tap into are not the best resource. And so what people do is they just kind of give up. And then they don't think, they're like, I'm not going to, there's no trust in the system. I'm not going back. And so I do think in overcoming some of those barriers are also making sure that you are tapping into trusted resources in community that can, even if I cannot do, can find you the right place to go, because you're not expected to know everything, and you're not expected to navigate all of these things alone. But we do have some responsibility for one another and ourselves to make sure that we are connecting in and we're communicating what our needs are, and just not giving up. So I do think those are many of the things that we can do to overcome those barriers. And then when there truly are barriers, that we don't give up, that we find that person that cares enough to be able to get us through that next hump.
Thank you, Stephanie, for that. We're going to be wrapping up shortly. Dr. West, I have a question for you. What are some practical strategies for preparing for medical visits? And we can start with you, Dr. West, and then Stephanie, you can also chime in.
I'm going to speak to the pediatric piece of this. It is so important to choose your pediatrician before your baby comes. And so many parents wait until that baby is here and it's time for an appointment, and then they just start calling around to figure out where they want to go. The relationship that you have with your pediatric provider is so important in that, especially in that first 6 months, right? You want a pediatric provider that has lactation support for you there, that is accessible to you. And you're not going to know that unless you do the homework beforehand. And this is where having a hub comes in, because once those families engage in that hub, then there's this, okay, here are all of your perinatal resources. This is where you are now. Do you want to see a prenatal chiropractor? Do you want to do a home birth? What are you looking for in terms of pain management for your delivery? And then as a part of that hub, as those women work their way through that cycle, then it's okay, where are you going to take your child for care after baby is born? Where can you get the best support? And so that sort of speaks back to the benefit of having that community that you can go to. Typically in hubs like this, if there's somebody out there that's not cutting the mustard, the mamas will let you know. The mama's fear will get all up in arms, and they'll be like, don't go there. So, being in community and knowing who's available is going to be really key to your success for your entire perinatal journey. And I think that sort of speaks to the importance of a hub, because Stephanie is not going to use a resource that mamas don't trust or that isn't providing care and where moms don't feel seen. I would never recommend anybody who I don't trust with my families. And, same thing with Urban Baby Beginnings. And so just providing that opportunity to hear and listen and get information. Information is the most important part of all of this. You have to know what's out there and what's available to you and what your power is.
Oh, that's very important. Be assertive about your rights, your power. Stephanie, would you like to add to that in reference to medical visits? How do we prepare?
I think the main thing is, yes, researching your provider, knowing what people believe about the provider, their experiences. You can go online and you are able to see some reviews from providers and things like that. I do think that that's really important. Preparing by interviewing, not accepting just that, this is my local doctor in the area and this is who everybody goes to, but these are my beliefs and values and the things that I need during my pregnancy or my postpartum recovery. I do think it's important to start early. A lot of women are starting too late in their prenatal care. There's a lot of things that need to happen prenatally early on in the first trimester that can't if you're thinking that you want to engage in the second or third trimester of pregnancy. And then also when you wait too late, your choices start to diminish as well in terms of what providers available to you. So I would like to elevate that. And then also, I think in preparing for your visits, we tell moms all the time, tell me the questions that you have. We're going to practice that together, but we're going to write those things down so that every time you go to the doctor, you have a little journal. In that journal, you're answering questions that you have that are popping up so that you can not only get the information that you need, that you don't operate from a standpoint of, I am fearful of being here. I'm stressed because I'm not necessarily feeling well. And now I've forgotten everything that I was supposed to say to you. So I think that it's important in those instances to prepare for your visits. I would also like to just tie up and remind women as well that you do need to have a primary care physician, and you do need to go to your postpartum visit, because often a lot of this care coordination and things that are happening, not just from the perspective of the pediatrician and the joint, couplet care, which means the mom and baby are cared for, together and watched and all those things, but the OBGYN and the PCP need to be engaged with you early on and often, because the PCP is going to follow you after your OBGYN discharges you. And if you don't have a primary care physician, they can't discharge you to someone else. And so that's really important as well.
That's good. Great information shared here today. Any remarks before we go? Let's start with you, Dr. West, and follow it up with Stephanie.
I really, really, really appreciate what Stephanie is doing with Urban Baby Beginnings and with these hubs. I think it's a great idea, a great concept, but I would also encourage us to think about what our local politics looks like and how that local politics feeds into national politics. Because again, we have a healthcare system that's incentivized by money. And, I tell people all the time, vote. It depends. It affects your children. It affects everything in your life. And so really just being politically active in any way that you can to make sure that the things that we need as human beings in this country become available to us. And so political participation is really going to help facilitate the healthcare change that we need in this country. But a lot of folks feel like, oh, the system's broken. What am I going to do? I don't like it, whatever. But you can't change it if you don't engage with it.
That is Dr. West, the golden words. And Virginia's General Assembly goes in session the second Wednesday of 2025. So for folks who are watching us and you know who your delegate is, your Virginia delegate is, or your senator, go to them with some of these issues of concerns, or talk or speak with the Dr. West to get a statement, or Stephanie to get a statement as well. All right, Stephanie, you're going to pretty much close us out now?
Absolutely, yeah. Getting ready to get to the end of the year. We've got a lot of things that we've been blessed for this year, but I want to remind all of our moms that you are not by yourself. The holidays is a really tough time a lot of times for families, and we just want you to know that we are here. We're here for you, not to hesitate to reach out. You may see us in one of the clinics or hospitals that we're in as well, but don't wait too late. Find that care, that support system, communicate what your needs are, get a Dr. West, you get someone that is on your side and giving you the best level of care as possible. Because in the end, like I said, we just want healthy moms, healthy babies, healthy families. And that all comes from just participating and all of us looking at community. So we appreciate, you all following along. And this year, this will be our last episode for the year. And so we're just really excited to tie it up, but also to remind everybody of just how important our moms are to all of us and how important our babies are and our dads. And, join in this movement and make sure that you are connected to a local hub in your area.
And knowing that you have rights and you can communicate whatever it is you like or dislike when it comes to your doctors or your nurses, or you can divorce them if you don't like it. But if you love them, stay with them. Okay. A lot taken away today. Thank you, Dr. West. And of course, Stephanie with Urban Baby Beginnings for this connection today. This episode is sponsored by Urban Baby Beginnings, and UBB will be back with new episodes in the new year. God bless you and happy holidays.
Thank you.